The last speaker is Dr. Chris Wanke, who is also part of the Center for Global Public Health. And she's talking about the Tufts Fogarty Training Programs in Namibia, India, and Ghana.
Thank you so much. It's a pleasure to be here, not least because I just got off a 30-hour plane ride from Namibia. But I'm delighted to have the chance to talk about our mentoring programs with all of our international colleagues. So the context of what I'm talking about is a little bit different. I'm not talking about programs or research. I'm talking about the people behind those. So I'm not going to outline research work that's being done globally by Tufts faculty. You've been hearing about that today. If I tried to do that, I wouldn't have enough time to talk about what I need to talk about. I don't want to exclude anyone, and it's not really the focus of what I want to try to convey to you today. So the focus is I'm going to talk mostly about international trainees at Tufts, but there are multiple Tufts residents, fellows, medical students, and PhD public health students who've participated in research. Few of them are mentioned by name, but I will try to note where our students are going. I'm also limiting my talk to infectious diseases because that's what I know. I'm certain there are other mentoring programs going on in the university, in the medical school and medical center, but I'm not talking about them today. You've probably seen this previously today. The red dots are all where we have research projects. So I need to talk about research projects insofar as it's important for that there are research projects ongoing for the students and trainees to work with. So why do we do international research and mentoring? Well, the Tufts mission includes global citizenship, and that's important to all of us. The bullet that's left out here is that we have a real ability in doing these projects with mentoring and research to build capacity in the countries and the institutions that we're working with. We have a set of unique medical problems of significant public health importance that we can address, and we're teasing out unique risks for these infectious diseases, genetics, diet, environment, among others. It also gives us the ability to do T3 to T4 translational research, that is to program and policy, also to do implementation kinds of studies, and to really not just publish papers, but to make a difference in the work that we're doing. And we have the opportunity to collaborate with extraordinary colleagues and institutions, and I hope I can give you a little bit of the sense of those as we go through this. So one of the important questions is, how do we sustain this kind of operation? Well, we've been very fortunate in infectious disease to have NIH training grants for our infectious disease fellows. We've also had a TALI fellowship, which is a family foundation fellowship that supports research for infectious disease fellows. For medical students, medical residents, and public health students, there are obviously different mechanisms of support, but it's always a bit touch and go from year to year, although the medical school has been very generous in supporting students who want to work internationally in that summer between their first and second year of medical school. But the major focus of what I'm going to talk about today is our NIH Fogarty AIDS International Research Training Program, or ATERP, which has allowed us to train trainees from Thailand, India, Vietnam, Cambodia, Kenya, Ghana, and Namibia, which is where I'm just coming back from. And the Fogarty Training Grant has allowed us to support students doing targeted small projects, short-term training, or to actually obtain degrees at Tufts. And the three major programs that our trainees have worked with to get degrees are the Masters of Public Health, the Masters of Clinical Research at the Sackler School, and the Master's programs in nutrition. And the programs will support either a master's level degree or a doctoral level degree. So in addition, we've had just very recently funded something called a Fogarty Global Health Innovation Grant, which is a joint grant between Christian Medical College in Vellore and Tufts, both the School of Medicine and the Tufts Medical Center, and Honorine, who is sitting here as one of the co-PIs of that with Dr. Gagandeep Kang at CMC and me. And Dr. Kang also has a Fogarty Global Infectious Disease Research Training Grant, of which she is the PI, and she has used that to send trainees from CMC, mostly to Honorine's lab, but to other places at Tufts as well. We've also had support from the Center for AIDS Research, or our CFAR, which has pilot project grants, which will support junior faculty either from the U.S. or select international sites in developing research projects which they can do with a CFAR mentor. So we've just seen pictures of VOI, so I won't spend much time here. We've actually had no trainees come from VOI to Tufts, but we've had an enormous number of students, trainees at all levels from Tufts who've worked on projects in VOI. And one that I might mention was an infectious disease fellow who spent 6 months in VOI, went on to get her own K23, looking at HPV disease in women in Kenya, and has been living in Kenya for the last couple of years, completing her research. So we've had success on both sides. In addition, in the black and white striped sweaters, Jane Wanweary, who was a Fogarty scholar at KEMRI, or the Kenya National Medical Research Institute, where she did translational and basic science work on Cryptosporidium. And she's now working in Malaysia as a research study coordinator for someone from Johns Hopkins. Steve Hong, who's pictured here, entered working in Namibia when he was an infectious disease fellow. Now he has a K23, which is based in Namibia, and where he's working on adherence to antiretroviral therapy. And I'd like to point out that multiple trainees at all levels from Tufts have worked on projects with Steve and others in Namibia, and that's from infectious disease fellows to undergraduates. It's been a very successful program. Most of our studies there are related to HIV, but they encompass adherence, food insecurity, drug and alcohol use, patient tracing, and drug resistance. So it's a very vibrant program. And the Namibia Fogarty Training Grant is the newest of our training grants. It's in association with the University of Namibia Medical School, which will graduate their very first class of medical students in December of this year. They're very excited. It's also with the Ministry of Health and Social Services in Namibia. Currently from Namibia, we have trainees who have applied for and been accepted but haven't yet started their studies. We have 2 CFAR pilot project awardees there, 1 applicant to the Masters of Public Health program, 1 applicant to the Doctorate of Public Health program, and this individual is the Dean of Nursing at the University of Namibia Medical School, so we would be very honored to have her attend. And we have 1 applicant to the nutrition school, and we currently have 2 short-term trainees who want to come to Tufts and work on data analysis, which is always a big challenge. Moving from Africa to India, we've worked for 10 to 15 years with YRG Care, which is one of the largest clinics providing HIV care in India. More than 8,000 patients have been cared for there. And we've worked with Sunita Sagayam, who was a Fogarty Fellow, and as a Fogarty Fellow earned her PhD, although she did not earn it at Tufts, she earned it at Madras Women's Christian College. And she has her own NIH grant, which was awarded to her to study nutritional and metabolic impact of antiretroviral therapy in India. This is a group photo of a group that met in 2012 at the National Institute for Research in Tuberculosis in Chennai, India. It's a very august group with 3 Tufts faculty members attending. It was funded by the ICMR, the Indian Council for Medical Research. And the reason I'm showing it is because the little white circles tell us all of the individuals at that program from throughout India who trained in the Fogarty here at Tufts. One of those is Padma Priya Darsini, who got her Master's of Clinical Research from the Sackler School. She's a senior scientist at what is called NERT now, the National Institute of Research in Tuberculosis. And she has 2 funded projects at NERT that she is the PI of. We've heard a lot about Christian Medical College, and I can't say that any more than I agree with everything wonderful that's been said. It's an extraordinary institution, and there's a wide variety of research that's available for our trainees to work with there, or to allow us to provide training for them to go back and expand their research. This is a group photo of the research group that we work most closely with. You can see Honorine there in the middle, and next to her is Cherry Kang, who's been an incredibly loyal contributor to these mentoring issues here at Tufts and at CMC. This is an infectious disease fellow who was doing a project in one of the peri-urban slums looking at the importance of flies in carrying disease. This is Rita Isaac, who came to Tufts to get her Master's of Public Health. She is the director at CMC of the Rural Unit for Health and Social Affairs. She has her own GRIP award, again like Sunita did, looking at the impact of intestinal function on antiretroviral therapy in rural India. She and Honorine and Cherry and I share a grant looking at intestinal microbiota and the impact of antiretroviral therapy, which was funded by a joint U.S.-India collaborative award. And Rita has mentored Tufts fellows, residents, and medical students and public health students at RUSA. Saumi Narayana Tuppal, who was here previously, but I think he's left, is a current Fogarty Fellow who has completed the Masters of Science in Clinical Research at Tufts, but is currently a PhD candidate in that program. And his thesis project is cost effectiveness of using tenofovir versus AZT in antiretroviral regimens in South India. And he's within 1 paper of finishing that doctoral degree. These are pictures from both CMC and the antiretroviral clinic there. Here in the down left corner is James McMahon, who is twice international trainee. He came to Tufts to do his ID fellowship from Melbourne, and then he went to do his research training at CMC, so we got him coming 2 different directions. And all in all, not counting the Tufts students, the Tufts ID fellows, any of the Tufts trainees, but just looking at the Fogarty has trained 10-degree candidates at Tufts in the last decade. 7 of them have gotten Masters of Public Health. 3 of them have gotten Masters of Science at the Clinical Research Institute across the street. 2 of those have enrolled for or have been awarded their PhDs. We have 1 student from Ghana who has just completed his Master's in Nutritional Epidemiology and is enrolled in the PhD program. And we have at least 10 non-degree trainees, many of whom have done laboratory work rather than just clinical studies. So we've had a very diverse group of trainees. And all of our trainees, as best as I can tell, have stayed in academics or stayed in research. We haven't lost a single one of our Fogarty trainees. So why do we do this international work? Well, we have the opportunity to work with incredible collaborators, very, very inspiring people. Again, not the least of which is from CMC, people at the YRG Care Clinic, people at the National Institute of Epidemiology in Chennai, people at the National Institute of Research in Tuberculosis, Hoper's Foundation, which is a drug treatment center in Chennai, the Voi Research Center, which Mkaya talked about, the University of Namibia School of Medicine and the Ministry of Health, and the Aga Khan School of Medicine. We've also had the opportunity to visit some very beautiful places on the face of the earth with these programs. And I would like to offer my sincere thanks to all of the Tufts faculty who I haven't mentioned, and the Tufts staff who've made these training programs possible by mentoring and supporting the trainees, helping them with adjustment to life in Boston and at Tufts. And I would like to give thanks to our trainees who are willing to leave home and their families for months or years to come and work with us at Tufts, and to their families and the institutions that sponsor them because they're willing to let them come. Thank you.